legislation that will benefit the citizens of Georgia. Governor Kemp, thank you for being with us as a part of not only this moment, but earlier today for the historic groundbreaking ceremony for the medical school building to support the new University of Georgia School of Medicine. I also want to thank Lieutenant Governor Burt Jones and members of the General Assembly who are also here today. Please join me in expressing our appreciation and support for the outstanding leadership of our state. At this time, it's my pleasure to introduce the 13th Lieutenant Governor of Georgia, Burt Jones. Lieutenant Governor Jones is an alumnus of the University of Georgia, graduated from UGA in 2004 with a bachelor's degree in history, and I should point out was a four-year letterman on the Bulldogs football team and was the permanent captain of the Georgia football team. Since graduating from UGA, the Lieutenant Governor has distinguished himself in business and public service, and I am proud not only to call him an alumnus of the University of Georgia, but to welcome him now to give his remarks. Thank you so much.
Thank you. Oh, good afternoon. Thank you, President Moorhead, for that kind introduction. And thank everyone for being here today. It is an exciting day in Athens, Georgia. I just came from the groundbreaking of the new medical school for the University of Georgia, and I'd like to recognize Jerry Moorhead, President Moorhead, and his staff. Let's give them a round of applause because they worked very hard to get that done. I will tell you that I think Sonny Perdue, the Chancellor of the Regent System, said it best when we were at the groundbreaking earlier, and I think it fits kind of what we're doing here today with this bill signing. He talked about our Governor Kemp has done a wonderful job in bringing economic development to the state of Georgia, and the state has grown exponentially in the last several years because of great leadership like Governor Kemp. And we have, as Chancellor Perdue said, we've got good problems we need to deal with. And one of those good problems is expanding the access to health care. And that is essentially what the bills that are going to be put before us that the governor will sign today do. And they expand access to health care. They expand access to rural areas, much like the rural area where I'm from and where a lot of the legislators that are here today are from as well. And that is very important. Because as the state continues to grow, we need them to be able to grow outside the metro Atlanta area. And in order to do that, we've got to be proactive about improving school systems, access to health care, and other needs, because that is what makes communities grow and what makes them prosper. And that's why I am excited today, particularly about a bill that I worked on with our legislative body and the Speaker of the House and Chairman Parrish there over in the House, along with other members here in the Senate as well. Worked on a certificate of need issue that was reforming a certificate of need that I don't think had been reformed in 50 years since it was put in place. And it was something that was prohibiting small communities from being able to expand access to health care. So I'm very excited about that. I'm very excited about Governor Kemp's leadership and his staff working with us on that project, as well as the Speaker and his staff working with us. And I think it will be good for Georgians. It will be good for communities all over the state, and I'm excited and look forward to Governor Kemp signing it into law today. And without further ado, I would like to introduce our 83rd governor of our state. He's been a pleasure to work with. In my first 2 years as Lieutenant Governor, I've known Governor Kemp a long time, and he cares about the state of Georgia, and he's doing a wonderful job growing the state of Georgia in the right way. So please give a warm welcome to our governor, Governor Brian Kemp.
Well, thank y'all very much. Well, good afternoon, everybody, and thank y'all so much for being here. Lieutenant Governor Jones, thank you for the kind words. It is great to have you back in Athens, and just want to thank you and the rest of the members of the General Assembly for your leadership. And I appreciate the kind words about growing our state and creating a lot of jobs, and you and the General Assembly are big partners in that effort, along with our friends at the local level that we've got such a great relationship with. President Moorhead, I want to thank you for, and your entire team, by the way, for hosting us here on the campus and at the Georgia Center for today's bill signings. And just want to thank you for that. I know we've got our Insurance Commissioner, General John King, with us today, the local Athens delegation. We got a bunch of other members of the General Assembly that I'll mention as I go through talking about the bills. But we also have some other great state leaders that don't get a lot of recognition that are here with us today. And I just want to thank Commissioner Russell Carlson and the team from the Department of Community Health for being here. I want to thank our friend and great leader, Dr. Kathleen Toomey, and her team from the Department of Public Health. I tell Dr. Toomey every time I see her, I'm glad I don't get to see as much as I did during the global pandemic. But she and her team continue to do a great job. We've got leaders from the Department of Human Services. We've got our friends at the local level, great leaders at the county commission level, and others from Oconee, Barrow, and Jackson County with us today. I want to thank you all for being here. The Georgia Alliance of Community Hospitals, the Georgia Hospital Association, the Georgia Association of Health Plans, the members of the Department of Community of Health Board, other leaders in higher education, and other healthcare leaders. We also have Dr. Valerie Montgomery Rice from the Morehouse School of Medicine, who is a great leader in her own right. And anybody else that I didn't mention, we're glad you're here too. So thank you all. You know, as I laid out in my State of the State address back in January, improving access and quality of health care for hardworking Georgians has been a top priority since I have taken office. We have had great success working with the men and women of the General Assembly in achieving those goals, and the numbers certainly speak for themselves. 87% of Georgia counties now have 3 or more health insurance carriers. In 2019, no county had more than 2. Enrollment in the private sector exchange has grown from 460,000 individuals to over 1.3 million, and premiums are down 11% on average statewide and up to 29% in rural areas around the state. We are proud of the progress that we have made, but we also know that we still have a lot of work to do to ensure all Georgians have access to quality, reliable health care. And the good news is today we are taking many steps forward in ensuring that reality. As was mentioned earlier, just down the road, we broke ground on the new University of Georgia School of Medicine, and we'll soon do the same at the new dental school at Georgia Southern. These projects will help meet one of the greatest needs facing our state, and that is our healthcare industry, having a well-trained, capable healthcare workforce. As we continue to experience record-breaking economic growth, the need for healthcare in all parts of our state is only going to increase. As the Lieutenant Governor mentioned, we're creating problems because we're growing so much, but it gives us more missions to work on, and that's why we're taking action now, both through these new facilities and through legislation, to ensure that we are ready to meet this need in the years to come. Another area of need is in the mental health and its impact on all ages. The greatest First Lady in the country, Marty Kemp, is also with us today and has been very focused on that, along with the members of the General Assembly, and I want to thank all of you for your good work on that critical issue. We took the first impactful steps in this area when I stood with the late Speaker Ralston 2 years ago and signed the Mental Health Parity Act. I'm glad that this year we again made progress with a record amount of money in this year's budget dedicated to mental health, well over $1 billion. I again want to thank our partners in the legislature for supporting these measures, as well as the legislation that I'm about to sign. First, I will sign HB 82, sponsored by Representative Mac Jackson, who's with us today, and carried in the Senate by Chairman Max Burns. This is another important measure in strengthening the healthcare system in rural areas by providing for an expanded rural physician tax credit, including physicians and now also dentists. We're encouraging more students from our great institutions of higher learning to practice in communities in desperate need of their services and expertise. But that is not all. The next bill I'll sign will be HB 872, sponsored by Chairman Lee Hawkins. Is Lee here today? I don't think he made it. And carried in the Senate by Senator Kay Kirkpatrick, which expands service cancelable loans for healthcare professionals to dental students who agree to practice in rural areas. Priority for these loans is given to students looking to practice in specialties experiencing shortages or distribution problems in rural counties. This bill further meets the needs of long overlooked parts of the state and helps connect students with opportunities where they can certainly make a difference. Next, I'll sign Senate Bill 480, sponsored by one of my floor leaders. I think he probably gets the award for traveling the greatest distance today. Senator Mike Hodges from Brunswick and St. Simons, and this bill was carried in the House by Chairwoman Sharon Cooper. This legislation provides student loan repayments for mental health and substance use professionals who are filling vital needs. Healthcare workers serving underserved youth or in unserved areas will now have an easier time supporting Georgians struggling with mental health and other illnesses. All of these measures are essential to the ongoing improvement of health outcomes in traditionally underserved parts of our state. Next, I'll sign Senate Bill 293, sponsored by Chairman Ben Watson and carried by Representative Sharon Cooper in the House, to help with staffing issues faced by our public health department. This legislation reorganizes county boards of public health by removing the requirement that the CEO be a licensed physician. Now the commissioner can appoint a district health director to serve as CEO of a local health department in each district. And even if they aren't a licensed medical professional, all they need to have is a master's degree in public health or a related field. The hardworking men and women of our Department of Public Health under Dr. Toomey's leadership have been critical to meeting the challenges of recent years, and we are glad to keep supporting them and the important work that they do. Next, I'll sign Senate Bill 377, sponsored by Chairman Blake Tillery in the Senate and carried by Chairwoman Katie Dempsey, who I believe is here in the House. That bill defines qualified residential treatment programs, bringing us into compliance. These initiatives are specific placement programs that will serve children with higher treatment needs who require a short-term placement outside of their family home. I want to recognize and thank the Department of Human Services and the Department of Community Health teams who saw this need and worked to fill it. Together, we will keep pursuing innovative solutions to the challenges we face in areas like this. Finally, I'll sign House Bill 1339, sponsored by Representative and Chairman Butch Parris, who's here with us, and carried by Chairman and Senator Bill Cowsert, who is also with us. This legislation is the result of a lot of hard work by both chambers, and especially our Lieutenant Governor and Speaker, addressing long-standing issues in our current significant need progress, as the Lieutenant Governor spoke to earlier. Now Georgians will have greater access to several important areas of health care, including psychiatric and substance abuse inpatient programs, basic prenatal services, birthing centers, general acute hospitals, and much more. It also increases the aggregate limit on tax credits for contributions to rural hospital organizations to $100 million, helping people across Georgia join us in supporting our rural hospitals. Again, I want to thank all of our partners in the General Assembly, both for supporting our priorities in the budget process and for crafting these important pieces of legislation. These measures are important steps in meeting essential needs like availability, workforce development, and mental health care. Thank you again to all the local and state leaders and to the associations and hardworking teams here today for the work that you have done in the last 3 months and the years that came before to reach this moment. With that, let's start signing some bills. Thank you all for being here.
Gray to the stage.
This is a rural physician's tax credit. All right, House Bill 82.
Thank you, Governor.
Next, the governor will sign House Bill 872.
This is the service cancelable loans for healthcare professionals, dental students. Budget going to be in this? I think you were a signer on this bill. You might as well be. Thank you, sir. All right, House Bill 872.
Next is Senate Bill 480, student loan repayment for mental health and substance abuse professionals.
All right, Senate Bill 480.
Senate Bill 293, the reorganization of county boards of public health.
We'll
residential treatment programs.